Great saphenous vein is formed by the medial end of dorsal venous arch, medial marginal vein. It ascends upwards 2.5 cm in front of the medial malleus. Then it crosses the medial surface of the lower one-third of the tibia. Then it runs upwards along the medial border of the tibia, otherwise finger breadth behind the medial border of the tibia, and appears in the roof of the popliteal fossa, otherwise it is present behind the knee joint. Then it ascends obliquely upwards along the medial aspect of the thigh and reaches to the saphenous opening, where it pierces the cribriform fascia and opens into the femoral vein. This is the course. Then if you come into the tributaries, this is the first tributary. Medial marginal vein is the first tributary. Then anterior leg vein, posterior arch vein, anterolateral vein, posterior medial vein, superficial epigastric vein, superficial circumflex iliac vein, superficial axonal pudendal, deep axonal pudendal. These are the tributaries. Then what are the perforators? At the level of the adductor canal, one perforator is there. That perforator what we call adductor canal perforator, otherwise Hunter's canal perforator or Hunter's perforator. This perforator is connecting the great saphenous vein with the femoral vein. Then below-knee perforator. Below-knee perforator is connecting the great saphenous vein with the posterior tibial vein. Then medial ankle perforator. There are three in number: upper, middle, and lower. Upper present at the level of the junction at the upper 2/3 and lower 1/3. It is connecting the posterior arch vein with the posterior tibial vein. Then lower one, it is present just below and behind the medial malleus. See, this is the medial malleus. Just below and behind the medial malleus, and it connects the posterior tibial vein with the posterior arch vein. In between these two perforators, there will be middle perforator. It is present at the level of the upper margin of medial malleus. It is also connecting the posterior arch vein with the posterior tibial vein. So these are the perforators. It contains 12 to 15 valves. In that 12 to 15, just before piercing the cribriform fascia, one, and at the junction of great saphenous vein and femoral vein, that junction what we call saphenofemoral junction, there one valve will be present. Remaining valves will be distributed along the course of this vein.